the U.S. healthcare market's $4 trillion, 4.3 trillion, according to CMS in 2022. And, you get different estimates. So if you look at Blue Cross Blue Shield Association of Michigan, they estimate $230 billion a year in fraudulent, wasteful, and abusive overpayments, right? There are other estimates that are as much as $700 or $800 billion a year in fraud, waste, and abuse. So whichever number you pick, it's a huge number. Even, people often want to say, oh, well, what can AI do to help? What can artificial intelligence AI do to help, solve the fraud, waste, and abuse problem in healthcare? And I think in answering that, you've got to start with categorically understanding what we mean when we say artificial intelligence. All AI is not the same. That's like saying, what can cars, what can vehicles do? Well, big, dump trucks can move earth. Ferraris can make you really happy going down the highway. So artificial intelligence is a category, but within that category, there are a number of different levels of sophistication. Okay, so there's some conventional artificial intelligence being used in the market today, addressing fraud, waste, and abuse. And think of conventional artificial intelligence as being, a really souped up Excel spreadsheet. All right, with really, really cool formulas in it. Our technology is called Integrate AI, and it's a patented artificial intelligence solution. But it's unique in that our Integrate AI platform has the ability to do two things. Number one is to view the claim, the healthcare claim, the bill that a provider submits for payment, to view that claim in context. Okay, so most technologies that are looking and evaluating whether to pay a healthcare bill, a claim, they look at the claim, that technology looks at the claim, makes sure it's coded correctly, and pays it. Our technology, Integrate AI, looks at that claim in the context of the behaviors of the provider, the relationships that providers have with other providers around that claim, and the context of the patient diagnosis, situation, geographic proximity, all of these different variables to evaluate that claim. And so it's looking at the claim in context, which allows you to see so much more of the environment in which that claim is even being submitted. Ultimately, as you know, the big question is, okay, of that $250 billion to $800 billion a year of fraud, waste, and abuse in the U.S., how much can a technology like Integrate AI actually help the payers, the system save? What we've seen so far in our work is dependent upon the sophistication of the healthcare payers, commercial insurance company, state Medicaid programs, et cetera. Depending upon the sophistication of their current technologies, what we've identified is that at minimum, we can double the amount of fraudulent, wasteful, and abusive billing detection and prevention at a minimum. So that's a 2x prevention capability. At a maximum, when you get into areas such as workers' compensation insurance and others that really have a lot of problematic behaviors in those areas, we've seen detections up to 10 times what current technology is seeing. So for us, you look at that range of a 2x to 10x improvement in the detection and prevention of fraudulent, wasteful, and abusive billing.